Hello friends, I am Dr. Parvinder Kaur. I am a gynecologist. I am a senior consultant at Woodlands Hospital, Narayan Memorial Hospital, Behala and Kothari Hospital. I am engaged in private practice in South Kolkata. Today, we would be discussing about the topic of vaginal discharge, which is often a nagging problem in female population. Those coming to vaginal discharge may fall in any age group. They can be young girls, they can be women in the reproductive age group, as also elderly women. Before I dive deep into this topic, it is important that we understand something which is really normal and we should be able to differentiate what is abnormal. When I talk about normal physiological things, it is important for us to ponder on certain things, like there are certain vaginal glands and cervical glands which produce some normal secretions, that is the normal vaginal fluid or the normal vaginal discharge, which is essentially protective in nature. It traps the harmful bacteria, it traps the harmful particles and it protects the genital tract. Thus, some amount of vaginal secretion is essentially normal. It is a common experience that some amount of vaginal discharge occurs just prior to the menses, just after the menses, as also in the mid-cycle. The amount of vaginal discharge increases in particular at the mid-cycle when it is the time of ovulation. Having copious white discharge in the mid-cycle and sometimes it may be speckled with little amount of blood, that is a normal phenomenon. It is a normal finding. It does not require any treatment. Increased vaginal discharge during sexual stimulation is also essentially a normal happening. It does not require any treatment. Of course, if the vaginal discharge is associated with foul smell, itching, burning in the genitalia, then it definitely requires treatment. As I said before, women in different age groups, prepubertal as less as 7 to 10 years, women in the reproductive age group as also the elderly population often present in our clinic with this nagging type of problems. Different age group has different type of etiologies or different causes which causes these maladies. So, let us come to them one by one. But before that, I would like to say a few words regarding certain gynecological cancers. Hold on, do not panic. I am not here to scare you, but it is important for us to hear this and understand this, that certain malignancies or certain cancers of the female genital tract, in particular cervical cancer, sometimes may present with a nagging vaginal discharge, which is often having a very bad odor. So, vaginal discharge is a topic which should not be taken very lightly. Often, vaginal discharge is forerunner of something called PID, that is pelvic inflammatory disease, which is an important cause which is giving rise to infertility. So, again I would like to stress on this, vaginal discharge has to be handled appropriately. Proper treatment is very necessary. So, as I said before, children as less as even 7 to 8 years sometimes come in our chamber with this problem. For them, the cause of vaginal discharge is of course very different. These are essentially prepubertal girls. For them, menses have not yet started. They are having very low levels of estrogen in their body. Estrogen essentially is a hormone which protects, which has varied functions in the female body. As regards the vagina, it gives a protective armor, a protective cover, it generates a protective environment in the vagina. So, these prepubertal girls, because of lack of estrogen, they become very vulnerable to infection because their vaginal defense is a bit on the lower side. They become prone to infection, sometimes they get infected with bacteria or with yeast. even foreign body in the vagina has been found out in some of my patients. All these things have to be kept in mind, the appropriate cause has to be found out, and accordingly the treatment has to be instituted. Then comes the next category. The next category is a very, very wide category. This is the category of the ladies in their reproductive age group. In this group, the majority of them, the major cause is genital infections, which can be bacterial, which can be viral, which can be protozoal, which can be fungal or yeast infection, which gives rise to vaginal discharge. Often this type of infection is coming from their partners. It comes under the parlance of something called sexually transmitted disease. So, when we are treating these ladies, it is important to treat their partners also. Otherwise, they will have recurrence of their problems. That means, even after we have treated them, sometimes they will come again and again with the same type of problem. So, treating their partners is of great importance and has to be done. It has been seen that those ladies who are having the problems of chronic anemia, diabetes, or any general ill health, debility, or those on chronic steroid use, or even those who are using long duration OC pills, or maybe the pregnant ladies, they are very much vulnerable to this type of infections. So, when we are treating these ladies, apart from giving them appropriate drugs to treat the infection, it is important for us to control their anemia, to see that their diabetes is controlled, to properly manage the dose of steroid, and to stress upon genital hygiene, and of course, appropriate information regarding the sexual health has to be given. Where appropriate, barrier contraception has to be promoted. These ladies, if left untreated, often develop something called PID. I was talking about this malady before also. PID is pelvic inflammatory disease. For a minute, let us refurbish our own anatomical knowledge. We all know female reproductive organs consist of an uterus, 2 ovaries and 2 tubes. These tubes, one on either side of the uterus, are known as fallopian tubes or oviducts. These tubes are essentially open in the inside. That means they directly communicate with the peritoneal cavity. So, if there is any infection ascending from below, it can reach potentially the peritoneal cavity. Hence, it is very important to treat the genital infections very, very appropriately. Third category, as I was saying, is the category of the elderly ladies. For them, they suffer from genital infections or vulvovaginitis or vaginitis. We actually call it senile vaginitis or senile vulvovaginitis. This is because of decreased estrogen level in their postmenopausal years. They are also at times very prone to infection. So, apart from treating their infection, it is important to supplement the treatment with something called topical estrogen application. So, having said this, I would like to draw your attention towards the key points. Maintaining vaginal hygiene or perineal hygiene is of utmost importance. Promote the wear of undergarments which are made of cotton and of breathable material. Use proper perineal wash. Maintain a healthy lifestyle, because health is wealth. If there is a problem, the doctor has to be consulted, appropriate treatment has to be given, and good health has to be promoted.